Hello, Eielson. We have been fielding many great questions surrounding COVID-19 testing. So here at the Eielson Med Group Laboratory, we put together a quick rundown of what labs are available and what each test really means. Broadly speaking, there are two types of testing available. One test is a nose or throat swab that detects the presence of SARS-CoV-2 RNA through a process called PCR. The second type of test is a blood test that checks to see if your immune system has developed antibodies to the SARS-CoV-2 virus. So let's talk about the first test, the one that directly detects the presence of the virus. The benefits of this test are that we can identify when someone is currently shedding viral RNA, which allows us to better contain the spread of COVID by recommending targeted public health measures and perform contact tracing. The other benefit is that the test is highly specific, which means it results in very few, if any, false positives. But it does have some drawbacks. The first is that for most viruses, to include SARS-CoV-2, there is a period after you have been infected and before you start having symptoms. This is called the incubation period. The virus cannot reliably be detected during this period, so a negative test does not rule out the possibility that you are in the incubation period. So for instance, if you were exposed to a patient with COVID or traveled through a high-risk area, we may recommend a 14-day self-isolation. A negative test during this time does not rule out infection with SARS-CoV-2. It simply means we could not detect the virus at the time the swab was taken from your nose or throat. The second drawback to this test is a less than ideal sensitivity, which means it has a fairly high false negative rate. The false negative rate could be as high as 30%. If we run this test on 100 patients with COVID, it would result in 70 true positives and about 30 false negatives. The lesson is that a negative test does not rule out COVID-19. If you have symptoms consistent with COVID-19, we have to assume that it is COVID-19 and use social isolation to limit the spread. So moving on to the second test. The second test is an antibody test. This is the newest test available on the market, and it is performed by a blood draw and attempts to detect the antibodies, usually IgG, directed against SARS-CoV-2 virus that your immune system produces after you've been exposed. There are, however, a couple of important pitfalls to this test. The first is that you don't develop sufficient antibodies to be detected for about 10 to 15 days. So this test really isn't useful until at least a couple of weeks after you've been infected. The second pitfall is that while IgG, the antibody your immune system produces, can be detected, it doesn't necessarily tell you how functional those antibodies are at conferring immunity to the virus. We assume it means you have some immunity, but we don't really know. So a positive test doesn't necessarily mean that you're fully immune, and more research is needed to determine what having these antibodies means to your health and for how long. The final pitfall is one of statistics, specifically what we call the positive predictive value, or the likelihood that a positive test means you actually have had COVID. The antibody test has the ability to produce false positives and false negatives. Depending on the manufacturer, this test probably has about a 1% false positive rate and a 1% false negative rate, which is actually really good for a new test. So let's see what happens if we were to test 100 members of the 354th Fighter Wing. If we assume that 1% of our population has had COVID, which is the going assumption currently for the state of Alaska, and we were to test 100 random individuals, presumably one of them has had COVID in the previous few months. That one individual will result in one positive test, hopefully. The other 99 individuals that have never had COVID will most likely result in a negative test, but with a 1% false positive rate, we can safely assume there will be at least one false positive. So when we look at all of the results in total, there will probably be at least 2 positive results, but only one of them is actually a true positive. The other, or others, is a false positive. Another way of saying this is that the positive predictive value, or the chance that a positive test means you actually have had COVID, is no higher than 50% currently. Even if we get a positive test, we cannot actually use it to counsel you on your risk at this time. This is the main reason why we do not recommend this test except for in very specific circumstances, like when someone has obvious sequelae from COVID. We hope this was helpful, and we're always standing by to answer questions. Please don't hesitate to reach out.